Hi, I'm Dr. Christopher Palmer. I'm a specialist in robotic total joint replacement surgery. The symptoms that patients may have with knee arthritis may be pain within the knee itself. They may have a painful limp. They may have lost some motion. They may have instability as well. They may feel just like their knee doesn't quite cooperate with them. Many patients have pain going up and down the stairs, getting up from a seated position. If you're experiencing any of these symptoms, I would recommend coming in and getting an evaluation. We can x-ray you, we can perform a physical exam, and then sit down as a team and discuss the non-surgical treatment options, whether that be injections, physical therapy, bracing, medications, or if needs be, surgical intervention. What's going on inside your knee with knee arthritis is three things. Number one is our joints are mechanical and over time they wear out. As we get less and less cartilage, then our knee starts to become inflamed, and that's where the pain comes from. Then bone spurs begin to form, and sometimes cysts form as well, which can be extremely painful. So with a modern total knee replacement, we're putting a metal cap on the end of the femur and essentially a metal tray on the top of the tibia. In between, we put a very special plastic that lasts somewhere between 15 to 20 years. With a partial knee replacement, that's where we're replacing only the part of the knee that has the problem. If you have arthritis in more than one part of your knee, then you'll need a total knee replacement. So if after evaluation, if we decided you need a knee replacement surgery, we'll pick a date together. The surgery will take about an hour. Afterwards, you'll be in the recovery room for a few hours. Most patients go home the same day nowadays with knee replacement surgeries. Before you go home, we'll have physical therapy work with you, make sure it's safe that you get up, get moving. Usually most patients are in physical therapy for 4 to 6 weeks after a knee replacement. And recovery usually takes about 3 to 4 months with a robotic knee replacement. Having a knee replacement is intimidating no matter how it's done. And what I'd like you to know is that we're a team. I want every patient that walks through the door to know that I want them to feel better, to feel that they are listened to, and that we really have your best interest at heart throughout this entire process. My hope for a patient after they've had a knee replacement is to be able to get back to the things they enjoyed before, or the things they feel like they've been missing out on. Playing with grandkids, kicking a soccer ball around, throwing a ball in the backyard, going for hikes, going for walks, taking your dog for a walk, exercising again, and just enjoying life and not feeling like you're missing out on things.